Welcome to the Leadership Voice. I'm your host, Jay Barbuto. Today's show is about adaptability in the healthcare industry. And joining us today is Tom Capizzi, Chief Human Resource Officer for CHOC. Tom has over 40 years of executive HR experience from many prestigious companies and industries. It is a pleasure to have him on the show today to share his wisdom and insights. Tom, please welcome to the show.
Thank you, Jay. Thanks for having me here on The Voice. Appreciate it.
Tom, it's great to have you here to share your wisdom and insights with our audience. Tom, why don't we jump right in? The first question is about CHOC. Could you tell us more about CHOC Children's Hospital and what it is that has made it such a success?
Well, thank you, Jay. CHOC is a unique place. CHOC has been around now close to almost 60 years now. What makes CHOC really special, it's its mission. Our mission is to nurture, advance, and protect the health and well-being of children. We go beyond beyond just a hospital setting. We are more of a healthcare system now for children. And so we're very excited. That's kind of what makes CHOC unique. We're providing a continuum of care across all areas for our children. It's an exciting time when you step through CHOC. It's an atypical setting when it comes to our kids. Especially children that need help and need our services. And so what makes it really unique is just that, our mission, our vision to be the leading destination of health for children.
That's amazing. Now, a lot of people may not know how a hospital that is dedicated to children, such as CHOC, and like you said, it's more of a healthcare system than just a hospital. But how does a place like CHOC, how is that different from the other types of hospitals that we might see out in our communities?
Well, and thanks, Jake. It's true. We are dedicated to our children. Our children, if you think about ages, really from age 21 to really newborns, we will take care of those type of children. We will track adults that are a little bit older than that, especially if they've been with us for many years for their services. But what makes CHOC unique is the fact that our approach is not just an immediate kind of hospital setting. We have a primary, a tertiary, quaternary type care setting. We really want to provide across the whole continuum, and we want to be able to take care of our children well before they're sick. So we're really thinking about well care and taking care of children from the time that they're born all the way up to the time when they become adults and then can transfer over to more of an adult setting. That's our goal. And I think what the program services that we provide really drive that. And the uniqueness of CHOC is the fact that we have that capability, that expertise across that whole continuum of healthcare.
So you're as much into prevention and like you said, wellness as you are into treating conditions.
Absolutely. What started as a hospital bed for kids that got sick is now a true healthcare system that we can provide, again, more just in terms of just care, immediate care. We can provide future care as well.
Oh, that's great. Tom, could you share a little bit about how the pandemic has changed things at CHOC? How have you had to rethink your operations, rethink your processes, rethink even the way you give care?
It's been a challenge for all of us to deal with COVID, but for healthcare, it's even a greater challenge because we really have to think about protecting our families and our patients and our associates, our employees here at CHOC as well, our volunteers. So we basically shifted. You're going to hear me use the word pivot. We've pivoted a lot, and as a healthcare environment, we had to pivot. We had to change our ways. We basically shut the campus down to our families and our patients that did not need immediate care, that didn't need obviously exact care to dealing with COVID or really just dealing with any health issues outside of any emergency. All that well care visits, all that elective surgery work, anything that we normally would have done on a day-to-day basis was put on hold. We tracked it, we monitored our families and our children, but at the same time, we obviously asked them not to come on campus. So what that created really for us is that we had to come up with a new way of managing our healthcare. Slowly but surely, we've been able to bring them back. But again, managing it very carefully in terms of protecting them and screening and creating a whole screening process by which our families, our associates, and our patients are screened on a regular basis. So again, we can screen for COVID, we can screen for the pandemic, but at the same time, we can still provide the quality of care that we stand for, that our mission is all about. The deal there is really providing the type of healthcare in a unique environment now. We've also moved into more remote work. We've taken employees and said, especially our back office employees, our employees who handle the day-to-day back office business for CHOC. It takes a village to run CHOC. So if you're not in direct patient care, I sent you home. I basically say, let's go work from home. Get off campus, again, protecting them, protecting our associates, and allowing them to work from home has really changed the way we do business effectively and still provide the level of care, but do it remotely. And we've created new programs and new processes to support that remoteness. There's over 1,300 associates right now working remotely off campus from CHOC right now, of over 5,000 that we have today working here.
So even with such a large number of employees that are now working from home, working remotely, still, I think with over 5,000 employees, you still have the vast majority, over 70% of your team is still coming in to provide service and care because of their required proximity, or they have to be there to provide the services that they provide.
Absolutely. We are still a 24-hour, 7-day-a-week program. We're here to take care of our children all day, every day. And so that takes a lot of folks to manage, 3 shifts and then specialty care. We have our specialty care clinics. We have our primary care clinics that are outside beyond the campus setting, are taking care of our children as well. And so it takes a lot to manage. Like I said, it takes a village to manage this large enterprise to take care of our children. And the commitment of our associates is they're here. They're masked. We have constant masking going on. We screen every day, all day. We're screening our associates. We screen our families. We screen any visitor to a campus. And then if someone's not feeling well, we tell them to stay home, monitor the symptoms. And if they need to be, they'll get tested. And we're really monitoring that very closely. And we're really protective of our associates and protective of our clinicians who are managing our children.
Thank you. Tom, you've described a lot of things that CHOC has had to rethink, and a lot of things that CHOC now has to do differently than it used to. In many ways, it's caused you to have to innovate and to rethink and recreate or redefine a lot of things. As you think about going through a process like this, a lot of times, a lot of companies, they sit in the doldrums, they're sad, they're disappointed, they feel like they can't operate when these kinds of moments happen. But we've found that the companies that find ways to adapt and find ways to pivot, they tend to thrive, and they tend to find ways of meeting needs and meeting services and continuing to make a big impact in the community. Clearly, CHOC has continued to make that impact. So when you think about CHOC in the long term, and we never want to think that something bad as the pandemic makes us better, but in a way, it can, because facing and overcoming and meeting the challenges can. Could you talk a little bit about how CHOC is probably going to be even better in the future because we've gone through these challenging times?
Oh, absolutely. As you said, Jay, mother of invention. The pandemic has created an opportunity for us to really rethink our processes. Healthcare is very slow to change. I come from, as you said, I'm over 40 years of HR. I come from many different industries. And I've done it from industries like consumer products and high tech, where if you're not changing every 3 to 6, 7 months with new products, you're dead in the water. You won't survive. Healthcare has been a bit slower when it comes to change. Unfortunately, the pandemic has obviously allowed us to rethink that. We created a command center concept by which we are managing day to day a lot what's going on with the pandemic through our command center. What that allowed us to do is allowed us to make decisions faster. And it actually kind of removed barriers to making decisions. And I think what's going to happen as we go forward is we may not have a command center, but that whole decision-making process has been now revamped and rethought through and delegated down. So people on the line are making more decisions quicker and faster. We're educating, we're training them, but they're making those decisions. which I think is going to make us a stronger organization. The other piece that really changed is telehealth. Many of you have seen how telehealth has changed the dynamic of healthcare. I would say about a year ago, we were at about 300 telehealth calls. We were struggling with telehealth. We couldn't figure it out. The pandemic, again, mother of invention, took us through that process. And today we are over 60,000 telehealth calls for our children. Our families were kind of leery about it because they like the high touch case of coming in and dealing with a doctor directly or dealing with a nurse directly. But the telehealth really took off. It really allowed us to really provide more service, more direct service to the families at home where they were obviously protecting themselves. And it's going to be something that's going to continue to the point where we have now created a whole new division at CHOC around the whole telehealth model. And it's here to stay. And I think it's going to just continue to evolve and become even more an integral part of our continuum of healthcare that we're going to provide our children.
Yeah, it's amazing how these innovations and these ways of rethinking care, there's always reasons not to do it yet.
Right.
And sometimes these situations put us in moments where we simply have to adapt now. And it sounds like in that way, CHOC has really met the challenge.
If we didn't, we would not be able to take care of the families and kids that we want to. And so we had to. You're right. And it will pay off. It paid off short term, and I think it's going to pay off much longer term as well for us.
No, that's terrific. So Tom, there's lots of organizations that have been faced with this challenge and are still facing this challenge. And in the future, who knows what the future may bring. I'm sure in the future, some organizations might face similar kinds of disruptions to work or emergencies, pandemics, or whatever it might be in our future. We can never fully predict it. But what advice would you give to an HR executive or any executive in the healthcare industry that might be facing disruptions in the future? What advice would you give them?
In healthcare, I would tell them, think outside the box. Stop thinking the old ways are the only ways. Really figure out ways to improve, break the mold. Take risk. And healthcare risk is not easy because obviously we're concerned about the risk of our kids and our families, and healthcare in general is somewhat risk averse. But take the risk, learn from it, and then move forward. And if there's an error relative to obviously not the healthcare of a child, but healthcare in general, you can fix that, you can manage that, learn from that and move forward. And we did that, we've done that, and we continue to do that. And the advice to even to the human resources executives around that as well is think about what your workforce needs, like going remote, giving them we gave them the tools, we gave them the training, thinking beyond that. Always make sure that you're thinking, and like playing chess, think about 2 or 3 steps ahead, especially when it comes to your HR issues out there, because this is not going to change. The pandemic's going to remain for us for a while. But ultimately, I think it allows us to kind of change our way of managing and thinking about managing our people and our families and our businesses.
Yeah, and it was great when you said that there's so many things that are here to stay. And when you say that these things are here to stay, it's not regrettably here to stay, but rather we've found new ways of serving people and impacting people. And those impactful ways are going to continue. We're
not going back. We're going forward. And that's really the way to think about it. Mm-hmm. Think about how you continue to move forward. Don't look behind you. You might run into a wall. So basically, always think and look forward.
No, I love it. So we do have a couple questions from our audience. So why don't we go ahead and take a look at those and see what we've got. So our first question, Tom, comes from Salvador Ramos from Anaheim, California. Salvador asks, what specific changes have you made to individual employee roles in order to keep them employed?
That's a great question, Salvador. We've had to really think, and as I said before, we pivoted around even jobs and positions. With the change, we've actually created new job levels now because we had to. And we actually have folks who are now identified as screeners, who literally their job is to sit there and screen our associates and our families as they come on campus. We didn't have that position 9 months ago, and we will probably continue along those lines. And some of those positions came out of other folks raising their hand saying, hey, I'm not really busy right now. I have time to give. Can I do something else? So instead of cutting hours, we shifted and created new roles and new jobs and new positions for folks. As we move to a remote workforce, we're changing that remote workforce job description as well. So many of our folks are now going to either be full-time, part-time, or ad hoc remote workers. And each one of those categories have its own ramifications as far as supporting them and the structure of their job. And we've changed that right now with about 1,400 of our employees. So we're very excited that we've had to do that. We've had to kind of pivot again around those positions to keep everyone employed. And I think that was our goal, to do the right thing for CHOC and keep folks employed in a way that we could effectively utilize their skills in a different way.
No, that's great. Thank you, Tom. So our second question comes from Lisa Nguyen from Fullerton, California. Lisa asks, with hospitals being overrun due to COVID-19, has CHOC taken a financial hit?
It's a good question, Lisa. I think we're all dealing with financial impact. Part of that is because most hospitals are run what they call on census, in terms of who's in your hospital at the time, who's in your healthcare system at the time. We monitor census both at the hospital level, but also in our primary care and specialty care clinics as well. And with the pandemic hitting, I would say we did take a hit early on in our fourth quarter this year. We're on a fiscal cycle. Our fiscal cycle runs from July 1st all the way to June 30th. So while we're in our fourth quarter now, we're kind of entering into that. We've passed our fourth quarter of 2020. We're into a new fiscal year right now. But as we got hit with that financial impact, we pivoted our financials. We moved our financials a bit differently. We managed it a bit differently, and allowed us to manage our people. CHOC had no layoffs. We didn't have to furlough folks. We redirected our financials in a creative way. We actually have one of the best CFOs, I think, on the planet. And she's actually an alumni of Cal State Fullerton. And she got very creative with the help of the rest of the executive team and her staff. And we worked out the financials very strongly. And I think we're stronger for it now. And we will continue along those lines. And again, we'll monitor it. And then if need be, we'll change. But financially, we're in much better shape than many of our associates or many of our colleagues around the area, especially the adult hospitals right now that are impacted very heavily, where we're not as impacted with COVID as they are.
Oh, that's great. Thank you, Tom. So our final question comes from Jennifer Robles from Irvine, California. Jennifer asks, how do you see healthcare changing in the post-pandemic world?
Well, as you said earlier, Jennifer, the post-pandemic is here. And once we get through the next phase of the pandemic, we're looking at a lot of different ways. The whole idea of the vaccine's coming, and what is that going to mean for us in healthcare with a vaccine? It's going to take a long time for that vaccine to kick in. We hopefully will re-educate our folks and families around taking vaccines, another opportunity for us. Telehealth is going to remain. I think that's going to be, like I said, we created a whole new division here at CHOC around telehealth. I think that's going to continue to evolve with technology. I think we're going to see more improvement in healthcare around the use of technology. We had to utilize the technologies to get through these last 10, 11 months. Where now I think we're seeing that the more we elevate our technology, the better healthcare we can provide. And so I think technology is going to drive that as well. And I think we're very excited about what that future brings. It's going to make healthcare stronger in a post-pandemic. I think we've learned a lot. All of us worldwide have learned a lot about not taking a lot of things too for granted and really being ready and being prepared. And I think healthcare is much stronger for that.
It seems like the companies that have been able to survive by adapting are now positioned to thrive in the future.
Absolutely. Adaptability, I mean, think about it, for us, it's part of our value system now. It's embedded in our values today. And we talk about making sure that we're addressing that every day. And I think it really is a key value we need to make sure thrives. And really, when we think about CHOC, it is a core to our values now.
Oh, that's terrific. Tom, I want to thank you for being on the show and sharing your wisdom and insights with our audience.
It's been my pleasure. Thank you for having me.
Thank you. I think that's about all the time we have for today. Today, we focused on adaptability in the healthcare industry. Our guest, Tom Capizzi from CHOC, And we are excited to have been able to spend this time with you, our audience. Please join us each episode of The Leadership Voice as we bring you relevant themes and topics to guide your leadership development. I'm Jay Barbuto, and on behalf of the Center for Leadership at Cal State Fullerton, we'll see you next time right here on The Leadership Voice.